You know that feeling when you're trying to get your head around a really complex topic and it just feels
Mm.
like you're drowning in information?
Yeah, absolutely. It can be overwhelming.
Well, that's exactly why we're here. Welcome to the deep dive. We basically take a big stack of sources, find the crucial bits, and, give you a fast track to understanding.
And today our deep dive is taking us into, well, a really important area of cat health, endomyocardial diseases. We've gathered some pretty detailed info on these conditions.
That's right. We're focusing on three specific issues. They affect the heart muscle and the inner lining of the heart in cats.
We're talking about endomyocarditis, endocardial fibrosis, and something called excessive moderator bands, or EMBs for short.
EMBs, okay.
So our goal today is really to unpack these three for you. We want to explain, what they actually are, the signs you might see, possible causes.
How they're diagnosed, what the treatment looks like.
Exactly. And we'll try to break down the medical terms as we go, so you hopefully finish this with a good grasp, not headache.
Sounds good. Okay, let's dive right in then. First up, endomyocarditis. That sounds pretty serious just from the name. What is it exactly?
It is serious. Endomyocarditis is an acute cardiopulmonary disease. So acute means it comes on suddenly.
Right.
And cardiopulmonary tells you it involves both the heart and the lungs. A really key feature is that it often pops up after a cat's gone through something stressful.
Ah, stress again.
Yeah. It involves inflammation of the heart muscle and that inner lining the endomyocardium, but critically, it also involves interstitial pneumonia.
Okay, pneumonia too.
Yes, inflammation within the lung tissue itself, and that can make it incredibly hard for the cat to get enough oxygen. Honestly, this lung inflammation is often severe, and it's a big reason why the condition can be fatal.
Wow, okay. That sounds incredibly aggressive and fast.
Ta-da.
Now, didn't the source material mention something kind of surprising about how often it's found?
It did, yeah. One report, when they looked at cats post-mortem, found the incidence of endomyocarditis was actually pretty similar to hypertrophic cardiomyopathy.
Really? But we hear so much more about HCM.
Exactly, which does make you wonder.
Yeah, could it be that endomyocarditis just isn't being recognized as often as it actually happens?
It's certainly possible.
So, who typically gets this? Is there a type of cat that's more susceptible?
Well, the data we looked at suggests it tends to hit young adult male cats the most, specifically between 1 and 4 years old. One report mentioned 62% of their cases were males.
1 to 4 years old, mostly males.
Okay.
And what are the sort of early signs, things an owner might notice?
The key thing historically is dyspnea, difficulty breathing, that starts after some kind of stressful event. And importantly, in a cat that seemed perfectly healthy before that stress.
Okay, so healthy cat, stressful event, then breathing problems.
Right. And interestingly, the breathing issues usually don't kick in immediately. They tend to show up, say, 5 to 21 days after the stressor.
That long after, wow.
Yeah. And there was also this curious seasonal thing in one report. A really high number of cases, 73% presented in August and September.
August and September, that's very specific. Wonder why. So what would a vet typically find when they examine a cat like this?
The main thing they'll see is that severe difficulty breathing, the dyspnea. They might hear occasional crackles in the lungs when they listen.
Okay.
Sometimes they'll pick up a heart murmur, that abnormal whooshing sound, or maybe a gallop rhythm, an extra heart sound. The murmur can even change in intensity.
Huh.
And in some cases, there might be signs of thromboembolic disease. That's blood clots causing blockages. But the key thing is the cat's history usually shows no major health problems before whatever stressful event seemed to trigger it all.
Right, that sudden onset after stress. So what kind of stressful events are we talking about? What could trigger endomyocarditis?
Well, the exact cause, we still don't know for sure. But the sources list several stressful incidents that seem to be risk factors.
Like what?
Things like anesthesia, for common procedures like neutering or declawing. Also vaccination, moving house, changing environment, or even just getting a bath.
Even a bath. Wow. Okay, so if a vet suspects this, how do they go about figuring it out? What's the diagnostic process?
Well, the first step is ruling out other things. It's called a differential diagnosis. They need to consider other heart diseases, hypertrophic, restrictive, dilated cardiomyopathy, congenital heart problems.
So other heart issues first.
Right. And because breathing difficulty is so prominent, they also have to think about primary lung problems, issues in the chest cavity like pleural effusion, problems in the mediastinum, even blood disorders affecting oxygen transport.
Okay.
And if the cat has collapsed or seems really weak, they'd also consider arrhythmias, neurological issues, metabolic problems, other causes of blood clots, even cancer.
That is a pretty long list of possibilities. What about the standard tests, like blood work or x-rays? Do they help narrow it down?
Routine blood tests, CBC, biochemistry, urinalysis, they aren't usually specific for endomyocarditis itself,
Yeah.
but imaging, especially chest x-rays, can be really helpful.
What might they show?
They might show cardiomegaly, an enlarged heart, and signs of fluid buildup in the lungs, what they call interstitial or alveolar infiltrates, or fluid around the lungs, pleural effusion.
Okay. And what about an echocardiogram? An ultrasound of the heart?
Yeah, an echo can give more clues. It might show a normal or maybe mildly enlarged left atrium. The wall thickness of the main pumping chamber, the left ventricle, might be normal or just slightly increased, maybe 0.6 to 0.7 centimeters.
Anything else specific on the echo?
Sometimes, though, it seems variable how often it's seen. They might find what's called a hyperchoic endomyocardium. Basically, the inner lining looks brighter than usual on the ultrasound. One report mentioned seeing it in up to 86% of cases, but others found it less common.
Interesting. And an ECG, the electrical trace of the heart.
Yes, ECGs often show sinus tachycardia, which is just a fast heart rate. But there have also been reports of abnormal beats, like ventricular and atrial premature complexes, and also issues with the electrical signals getting through the heart, things like bundle branch block or even complete AV block.
And if a cat doesn't make it and they do a post-mortem, what does the disease actually look like then?
Pathologically, that interstitial pneumonia, the lung inflammation, is pretty consistently found. The left side of the heart is often enlarged. The inner lining of the left ventricle might look kind of cloudy, opaque, maybe little pinpoint hemorrhages.
Okay.
And a really striking feature is endocardial fibroplasia. That's an abnormal buildup of fibrous tissue in that heart lining. Under the microscope, they usually see inflammation in the heart muscle itself, with various immune cells present neutrophils, lymphocytes, plasma cells, macrophages.
Given how severe this sounds, what can actually be done? How is endomyocarditis treated?
Yeah, that's the tough part. Unfortunately, there isn't one specific proven treatment protocol. The main focus is supportive care,
Like what?
like giving oxygen, maybe in an oxygen cage. In really severe cases, mechanical ventilation to help them breathe. Medications like steroids, diuretics like furosemide, and drugs to open up blood vessels, vasodilators, they've all been tried, but we don't really know how effective they truly are.
So it's mostly managing the crisis.
Pretty much. A small percentage of cats do survive, and interestingly, they often don't seem to need long-term heart medication afterwards. But the overall prognosis, the outlook, is generally poor. Although it's worth noting that cats who do survive might go on to develop fibrosis, like scarring, in that inner lining of the left ventricle later on.
That's a really tough picture. Okay, let's move on to the second condition you mentioned. Endocardial fibroelastosis. What's that one about?
Right, endocardial fibroelastosis. This one's different. It's a congenital heart disease.
Congenital, so they're born with it.
Exactly. It's characterized by a really severe fibrous thickening of the endocardium, that inner heart lining. This thickening makes it hard for the heart to work right, leading to heart failure. It affects both the heart's ability to relax and fill diastolic function and its ability to pump blood out systolic function.
And who gets this? Kittens.
Yes, it typically shows up very early. Cats with this tend to develop heart failure signs, either affecting both sides of the heart or just the left side, usually before they're even 6 months old.
6 months. So tiny. What would an owner notice in a young kitten?
The signs can look like other kinds of heart failure in young animals.
Oh, yeah.
Being very tired, lethargic, weak, maybe even collapsing or fainting spells.
Oh, dear.
Poor appetite, not gaining weight properly, difficulty breathing, rapid breathing, maybe cyanosis, that bluish tinge to the gums because of low oxygen.
Okay.
Some might get a swollen belly from fluid buildup, and sometimes you might see signs of a blood clot, like weakness or paralysis in a leg.
And what about at the vets? What would they find on exam?
It's common to hear a gallop rhythm when listening to the heart. They might also hear a systolic murmur, which could mean the mitral valve isn't closing right, mitral regurgitation. Difficulty breathing, increased lung sounds like crackles are often there. If there's been a clot, you might see that limb weakness or paralysis, and the pulses in that leg, the femoral pulses, might be weak or absent. Arrhythmias, irregular heartbeats are also possible.
Do we have any idea what causes this one? Endocardial fibroelastosis.
Still unknown, unfortunately. But there's a suspicion it might run in families or be inherited in certain breeds. Specifically, Burmese and Siamese cats have been mentioned.
Ah, so maybe a genetic link there.
Possibly, yeah. Suggests a genetic component might be involved.
So for diagnosis, what are the key tools for this condition?
Well, again, the list of possibilities overlaps with endomyocarditis and also with the excessive moderator bands we'll discuss next. Chest x-rays are likely to show an enlarged heart, cardiomegaly, and those signs of fluid in the lungs or chest cavity.
And the echo?
Echocardiography can help, though there seems to be less specific data published for this condition compared to some others. It might show reduced pumping function of the left ventricle and an enlarged left atrium.
What about the ECG?
ECGs often show signs suggesting the left side of the heart is enlarged. The basic rhythm is usually normal sinus rhythm, but various arrhythmias can definitely pop up.
And if they look at the heart tissue itself, what are the characteristic findings?
The key things are dilation or enlargement of both the left ventricle and the left atrium. And this really significant diffuse thickening of the endocardium. It looks white and opaque.
Okay.
Under the microscope, you see this diffuse thickening is made of fibroelastic tissue, but it doesn't have many cells. It's hypocellular. There's also often edema, fluid buildup in the heart muscle itself, and the lymphatic vessels in the heart might be dilated.
How do they treat endocardial fibroelastosis? Is there anything that can be done?
Treatment is really about managing the heart failure symptoms as best as possible. Supportive care is key.
Like oxygen?
Yes, giving oxygen, ideally in a low-stress way like an oxygen cage. If there's significant fluid in the chest, pleural effusion, they might need to drain it. That's thoracocentesis. For acute severe heart failure, they might use injectable furosemide, the diuretic, and maybe topical nitroglycerin ointment. If there are serious arrhythmias, they try to stabilize the kitten first, then treat the rhythm problem with things like calcium channel blockers or beta blockers if it's rapid atrial fibrillation.
Any other meds?
Maybe digoxin if there's also evidence the heart muscle itself is weak, like in dilated cardiomyopathy. In really tough cases with fluid buildup, they might even use a drug called nitroprusside for a short time.
And long-term?
For chronic heart failure management, it's typically furosemide and an ACE inhibitor like enalapril. Digoxin might be added once things are more stable, but honestly, the prognosis is generally poor.
Yeah.
Medical treatment might prolong life a bit, but a full recovery is very unlikely.
That's just heartbreaking for those little kittens and their owners. Okay, let's talk about the last one. Excessive moderator bands, EMBs. What exactly are those?
Right, EMBs. These are considered a rare pathologic finding. Now, moderator bands are normally found. They're muscle fibers found in the right ventricle. That's normal.
Okay, in the right side.
Yes. But in this condition, similar muscular bands show up abnormally in the left ventricle.
Ah, so they're in the wrong place. Which cats get this?
It can actually be found in cats of any age. But if they find them in a young kitten, it makes vets lean towards thinking it's probably a congenital malformation, something the kitten was born with.
Okay. And are the signs and exam findings different for EMBs compared to, say, endocardial fibroelastosis?
Well, interestingly, no. The history owner's report and the findings on the physical exam are actually remarkably similar to what we just discussed for endocardial fibroelastosis.
Really? The same list?
Pretty much. Lethargy, weakness, collapse, poor appetite, difficulty breathing, rapid breathing, cyanosis, swollen abdomen, maybe signs of blood clots like limb paralysis.
Wow.
And the physical exam findings also tend to mirror it. Gallop sounds, murmurs, breathing difficulty, crackles in the lungs, maybe signs of a clot or arrhythmias.
Okay, so if the signs are so similar, how on earth do vets diagnose EMBs? That sounds tricky.
It is tricky. The differential diagnosis list, again, includes the other two we've talked about, endomyocarditis and endocardial fibroelastosis. And it particularly overlaps with a condition called restrictive cardiomyopathy.
Why restrictive?
Because the findings on the echocardiogram can look very much alike.
Ah, okay.
Yeah.
So imaging is key again.
Yes. Chest x-rays will likely show the enlarged heart and fluid buildup, just like the others. On the echo, as I said, it can be hard to distinguish from restrictive cardiomyopathy, but sometimes you can actually visualize this network of what they call false tendons within the left ventricle.
Okay, tendons.
Yeah, these abnormal bands. ECG findings can be quite varied with EMBs. There are reports of things like AV blocks, slow heart rate, sinus bradycardia, right bundle branch block, left axis deviation, a real mix.
And pathologically, what do these bands actually look like if you examine the heart?
The inner surface of the left ventricle often looks irregular. The very tip, the apex, might seem more rounded than usual. And you see these numerous irregular bands, the false tendons, crossing the left ventricle.
Right.
The heart itself might weigh more than normal. And these bands, they're made up of specialized heart muscle cells, Purkinje fibers involved in electrical conduction, and also collagen, which is connective tissue.
Is the treatment for EMBs any different from endocardial fibroelastosis given the similarities?
Nope. The treatment approach is essentially the same. It really focuses on supportive care and managing the signs of heart failure.
So oxygen, draining fluid.
Exactly. Oxygen therapy, thoracocentesis if needed. For acute heart failure, injectable diuretics like furosemide, maybe nitroglycerin, managing any arrhythmias carefully. Nitroprusside for really resistant fluid buildup.
And long-term.
Long-term, usually furosemide and an ACE inhibitor like enalapril, maybe digoxin considered once stable. But again, unfortunately, just like with endocardial fibroelastosis, the prognosis for EMBs is generally poor. Treatment might buy some time, but a recovery isn't really expected.
Right. So looking across all three of these endomyocarditis, endocardial fibroelastosis, and EMBs, what are the sort of big picture takeaways, the main things to remember?
Yeah, there are several key points that really stand out from the sources. First, and this is a big one, we don't actually know the underlying cause for any of these three conditions.
Still unknown causes for all three.
Right, which obviously makes prevention difficult, and it hinders developing treatments that really target the root cause. Second, the potential role of stress, specifically as a trigger for endomyocarditis, is definitely something highlighted in the information.
That stress link seems important.
It does. Third, diagnosis is clearly challenging. The signs, the echo findings, they can overlap a lot, not just between these three conditions, but also with other common heart diseases in cats, like hypertrophic or restrictive cardiomyopathy.
Making it hard to pinpoint exactly what's going on.
Exactly. And finally, it's really crucial to understand that the treatments we currently have are mostly supportive. They aim to manage the symptoms of heart failure, keep the cat comfortable, but they don't reverse the underlying damage to the heart muscle or lining.
Okay, that really puts it into perspective. So we've taken a pretty thorough deep dive now into endomyocarditis, endocardial fibroelastosis, and excessive moderator bands in cats. We've covered what they are, the signs, the diagnostic hurdles, treatment options, all based on the info in our sources.
Exactly. We've tried to pull out the core information, give you a clear overview so you have a solid understanding without getting totally bogged down in, dense medical texts.
Definitely helpful. And that brings us to maybe a final thought for you, the listener. We talked about that potential link between stress and endomyocarditis. So maybe something to ponder is, what practical steps might cat owners think about to help minimize stress for their cats? Kind of goes beyond just these specific diseases, doesn't it? It touches on just their overall well-being.
That's a really valuable question for every cat owner to consider. Absolutely.
Well, thank you for joining us for this deep dive.